This is a Mr. John Parker, one of our patients. He started about a month ago. We'll go through this imaging here. We've got a nice sagittal view. If you go through and we look at the discs as we go down, you'll see in here we've got some blackening here, which just means there's some lack of water in that disc. Got a little tiny slippage in here. Mr. Parker was diagnosed with spinal stenosis, both in the lateral foramens, bilaterally. This disc is, obviously you can see it is poking backwards here. He had consulted with a surgeon in Northern Virginia, was basically told that his only choice for treatment was going to be a cage, multiple pedicle screws, and rods. He came to us from a referral from his primary care physician and also a friend to see if we could help. Mr. Parker initially hurt this about 2 years ago on a motorcycle accident, seemed to shake it off, and with time and painting, actually, he was standing on a ladder, extended backwards, and just felt an excruciating pain. About 12 visits later, he's about completely pain-free. He went from a 9 of a 10 on what we call the VAS, which is a way that we rate pain. Both chiropractors and medical doctors and surgeons, we all kind of rate it the same way. He has shown great improvement. Just got through walking a 10-mile Marine Corps marathon. He walked 10 miles of it with no residuals whatsoever. We've now started core strength training with him that he could not do at his physical therapist's office before due to the amount of injury he had. He was just incapable of completing physical therapy to start with. Failed at epidural steroid injections, failed at NSAIDs, failed at muscle relaxers, and so with non-surgical spinal decompression, this patient has gotten his life back. You can also see there's a little bit of central canal stenosing in here. This is the spinal cord that comes all the way down, and you can see here that the cord isn't quite as clean here. However, the strange thing is he is not exhibiting the signs of central canal stenosis. The only signs he seems to be exhibiting were the lateral canal stenosis, and he is doing quite fine right now. He will be coming in for an interview, and you'll see him here shortly in part of this video. Thank you. Just another one of our cases, and this is common. He is not an outlier. We get results like this all the time. The vast majority of spinal surgeries are elective back surgeries. If you're not poo-pooing in your pants and you're not pee-peeing in your pants and you don't have a cancer or tumor, chances are you have an elective back surgery. So don't be so afraid of it unless a surgeon tells you your surgery is not elective. If it's elective, you need to come in here and consult with us because we see severe cases like this all the time, and it is our standard that they get better.